Mbona umeficha hivyo? Mimi nimepata pad na wewe.
Alafu na mimi nimepata tamponi. Unazunguka, unajua when your fertility days are, and then you know your ready days are coming, and then you see like.
Hello, wherever you are watching us from, welcome to Before 18, your number one program that focuses on children. We discuss issues, different issues on children, from child protection, whether it is issues, sexual violence, violence against children in general, and all that. And today we are in Kiserian in Kajiado County to bring you the amazing story of one lady who has dedicated her life to ensure that the dignity of girls is restored. And today I am with her. I'm so excited to have this wonderful lady today. Karibu sana.
Asante sana. My name is Roisa Kerry. I'm a public health practitioner and a menstrual hygiene advocate. I do talk about menstruation and girls' dignity on a daily basis, if I say. Yeah.
Wow. So Roisa, before we go deeper into the conversation about dignity, girls' dignity, tell us about who is Roisa? Where do you come from? What is your background? Yeah,
Roisa Kerry is, I can say, is a young lady. You want to know my age?
No, we don't mind. But yes.
So Roisa Kerry has a background in public health. And I know most people know like public health is a broad term. We cover so many things, basically in preventive healthcare. We're not like doing curative, but as well I do run a hospital, so I'm in curative as well. But my background and career is purely in public health. And my focus is in water, sanitation and hygiene, where we do a lot of activities in schools, because we believe we are able to nurture the young kids from the junior years, primary school and secondary school. It's easy for us to get people good health when they grow up.
Wow. So Roisa, where does Roisa come from? Ulilelewa wapi? Ushago? Ushago ni wapi? Unajua huku hivi watu wako kazi huku Nairobi na huku Kajiado. Ushago ni wapi? Na maybe do you have any interesting any childhood story that relates to what you do now? Start with Ushago kwanza.
Roisa Kerry amezaliwa Kisii North. Kisii North is the current Nyamira County. Nimezaliwa in a family of 7, 4 boys and 3 girls. I happen to be a firstborn among the 3 girls, but I'm in the middle. I'm not the firstborn. Yeah. So in this family, I had very good brothers who are like my mentors. They have been leading me all along. And as well, I can say my childhood was a normal. Can I say? Childhood. Yeah, a normal. I was brought up in a normal way. My father was in politics and my mom is a peasant. Yeah, my childhood life was normal. It was normal. Okay. Yeah. I faced the normal challenges the young girls face, especially during puberty and menstruation. In fact, I never got to discuss about growing up as a child with my family, my father, my mother, no, my brothers. Because being the eldest among the girls, I just felt like I need to be on my own. Yeah. And some of the things I learned them in school. In the primary school, I schooled back at home, is called Mungori Primary School. So I remember during mentorship, if the teachers were to talk about periods, we used to have something called assembly, like boys sit with the male teachers, and as the girls, we have to have our conversations with the female teachers. So, and then even the way the issues were being brought up those days, it was more stigmatizing, because if a girl had a boyfriend, alikuwa anaitwa uko mbele, anachapwa. So which means the teachers were scaring us from being It's that kind of relationship. And conversations about menstruations were not there. I can't remember. I don't even recall in the school seeing maybe people coming in to give mentorship about menstruations or giving dignity kits. But I remember when I was maybe in class 1, still Moi was in the government, we used to receive the maziwa ya Nyayo.
Oh,
So,
yeah.
Yeah, so like that's the thing I remember that in my primary school I got. But as I grew up as a young girl, you face normal challenges. And maybe when I started my periods, I was in Form 1 and nobody was talking to me about periods. And the first time I had them, I went to the shop, I bought a cotton wool and started using it. So I didn't know about the parts, and then later like I had to learn about the parts from my classmates. But I can say I had a very supportive family. Maybe my father, my mom knew like you need some personal items. I used to get pocket money. I was in a boarding school, even if I wasn't in school. When you're at home during holiday, I used to get some pocket money. And also, I'm brought up from a family where everybody is an entrepreneur from even an earlier age. We used to do some small farming. You do your onions, you do your tomatoes. Even during the harvesting for us, like you can go where they've harvested maize to just like collecting. I don't know where you're coming from, all those things like that. And then you make your own money.
Yeah.
As well, my father used to grow a lot of firetlam, and then he has a lot of tea. For us, we used to work for him, and then we make our own money. So, yes, at least I used to have my pocket money to do my things.
Wow.
Yeah.
Money by your own.
Yeah.
Wow. So the other question, actually, before we go further, which high school did you go to, and maybe university? Do you mind sharing? Tujue?
Still is okay. I schooled in so many high schools, I don't want to mention.
Oh, okay, okay. Acha tuanze ya kwanza.
I was a academic nomadic, if I say so. I happened to go to St. Andrew's Kawa Girls. So then I went to St. Teresa's. And then I went to Mungori High School. And then I went to another Adventist school.
Wow, wow.
So, yeah.
So those are 4. What happened hapo katikati?
No, the reason is like I'm from a multi-religious as well, if I say. My father, fortunately, he was baptized this Saturday as an Adventist. But before, my father was more of a Catholic and my mom was an Adventist. So my father wanted me to attend a Catholic school. So I was admitted in a Catholic school in St. Andrew's Kawa Girls. After admission, maybe first term was okay. Second term, my brother came to visit me in the school, and the father chased him. So the teacher told me like, oh, your brother came, but the father never allowed him to come in. And then like, I liked being an Adventist because I was a leader in the church, in the Pathfinder and other things. So I was missing those things. And then I felt like I need to go to an Adventist school. So I struck a deal with my mother. My father never knew that I'd left that school. So I went home. In fact, it was funny because I remember my 2 brothers took me to school on a Sunday. And on Wednesday, I was back at home. I had stricken a deal with my mother. I told her I don't want to be in that school. And she went to the nearby school. It was her day school. She sneaked me in. My father didn't know. So,
wow.
Yes, I don't want to mention those.
So the second school?
Yeah, the second school was a day school. And then, now my father never liked me to be in a day school, but as well I was performing, I was leading the school. It was a mixed school, but it had its own challenge. So, again in this day school, like I felt like I need to go back to a boarding school.
That's after how long? After how long?
I think Form 1 I schooled in 2 schools. Form 3 in 2 schools.
Form 4?
Form 3 and Form 4 is the same school. So, and see, we leave this school.
Form 2, wow.
Just forget about
Wow.
the
But it's interesting. So let me hear from you. from all those schools, what was your experience about maybe menstrual health or menstrual hygiene that is maybe inspiring you to do what you do now?
Maybe I can say from the schools, there's something I call stigma. I remember when I was Form 1, when I was transferred to a mixed school. In fact, the previous school we were having different subjects, and then when I joined a new school, they were having totally maybe different subject, but I was intelligent, if I say. Because in my school, my previous school, St. Andrews, we were doing computer, and there was into agriculture, and we are doing all those different courses. Of course, in the other school, I was doing home science. But when I wasn't doing home science in my other school. When I joined the other school, there wasn't computer, but there was home science, there was agriculture, and there was music. So 3 new subjects that I wasn't doing. And then since I really liked agriculture, and I was best in agriculture, but I never liked home science, I never liked music. So the home science teacher, I think me and her, unfortunately she died. We were never friends because I never liked that subject. But it happened like in the same school where I was, my brother, the one I follow, was in this day school. He was best in everything. And the teachers all the time, they wanted me to be like him. So since I never liked home science, the teacher used to beat me, to cane me. And then one day, I remember, I don't know what happened. It was during games time. It happened, there was a fabric that one girl had used for menses na akamaliza akaiacha hapo kwa washroom za wasichana. So this home science teacher alituita akaanza kutu lecture. We are so many girls, like as we were from once, and I was very shy by the way. Akaanza kutu lecture, so she put aside few girls na akapointi mmoja who was my friend. Juu alikuwa mnono, and me I was fat. Now I'm thin by the way. Then
Okay.
Yes.
You will tell us later on.
Yes, and then this story was a little bit stigmatizing, but then I didn't see the importance of talking about menstruation. And then I never thought anything that in future maybe I was to discuss about periods or maybe sexual reproductive health, because sex is a taboo subject, I believe, even where you're coming from. So as I grew up after high school, after university, and then I joined the Ministry of Health through the support, like after my internship, I was working with the Ministry of Health, Port Health in Mombasa. After Mombasa, I came to Nairobi, and then in Afya House, one of my lecturer, his name is Benjamin Milkomen, was the senior public health there. So he invited me to conferences. I started attending sanitation conferences. But before the sanitation conferences, I and my friends used to do mentorship about drugs and substance abuse, teenage pregnancies, and just mentorship ile tunaongea. And during that time, we were giving dignity kits. And then one of my friends, who is a man, used to force me like to accompany them to distribute sanitary pads. But I was like, I don't want to go. He was really passionate about it and advocating for environmental conservation. So for him, he was giving sanitary pads sponsored by the Hindu Council of Kenya. Akiniambia, Kerubo, leo tunaenda Suso, namwambia saa enda. Nilikuwa nimelala nikasoka, so siwezi enda because it was a Sunday or a Saturday. Kerubo, next week tunaenda somewhere. Nikamwambia, Cyprian, I'm not willing to go. But slowly, with time, I saw like it's a passion and there is need to advocate for menstrual health issues in the country and within my reach. I started doing trainings and advocacy about menstrual health. Through that advocacy, I got someone who was interested in me to work for them. It's a Danish company called Really Relief. So Really Relief employed me as a wash and healthy manager. Through that platform, we were making reusable sanitary pads and as well advocating for other menstrual products like the menstrual cups. And then like it's a passion, so we're talking about it. we started moving around East Africa and Kenya. I've covered all the 47 counties talking about periods.
Now, someone might be wondering, why is this guy interviewing a lady about periods and he's a man? Maybe I want to hear from you. How important is it for us to discuss if it is periods?
First, I think this is something everybody should talk about because I believe we all exist because 1 month our mothers never had their periods, and then that meant like they conceived us. So for me, menstruation is a matter of human rights. It's a basic biological process that through that cycle, life is brought to this world. And for us to demystify all the myths and misconceptions surrounding periods, boys and men should be part of the conversation, because we just discover when boys are leading in some of this conversation, girls are free. But when boys are telling you like you have moods like someone who has periods, and then it makes these girls feel ashamed, and then that shame make them like even lose their self-esteem. Yeah.
So wewe ukaamua you want to campaign for, you want to be like, do I say an activist on sanitation and wash, that is.
Yeah.
So tell us a little bit, what areas do you guys cover, and especially the areas that you cover when you're dealing with creating awareness and all that?
Yeah, I see like menstrual health is a prerequisite to achieve the 17 SDGs. Good health is part of it. We have quality education, gender equality, and then water, sanitation and hygiene is there, including even partnership and participation. Because if we talk about good health, if a girl is using an hygienic product, they're going to get sick. If men can't be part of the conversation, we are going to have issues of gender equalities, because boys are going to be class while girls are back at home because they don't have maybe product to manage their periods. Globally, menstruation is a taboo subject because in most countries, including the already developed countries, this is not like something people talk about. So being that taboo subject, it means it has a lot of stigma, and then stigma brings about psychological issues to the affected person, especially the young girls. If I talk about Kenya, we've had cases of transactional sex where girls are engaging in sex to get the sanitary pads or other things. Maybe they want a lotion or pads or panties. And in some places you find due to period poverty, some girls in some slums are collecting already used, disposed sanitary pads to reuse them. So this predisposes them to infections. And because of period poverty, in areas like Tana River and some parts of Kenya, you find girls are using unhygienic materials during that time of the month. Some are sitting on soil, some are using bird feathers, some are using even kibuyu, some are using the cow dung. Just imagine this kind of things they're using. And some to some extent they're using, if you go to school, you find girls are cutting blankets, mattresses to manage their flow during that time of the month. So it means it's making girls remain behind if they can't find something to use, or due to the odor, the bad smell coming from the blood. Maybe akisikia kama ametumia something which is not hygienic, and then ananuka, unajua there's that embarrassment. You never want to come back to school. And some girls are being ashamed by their own teachers, and even girls as well. They're just making jokes at them. If you soil your dress, unajua wanaanza kukucheka kabla they tell you like there's something that you need to sort out. Yeah, those are the challenges our girls are facing. And then we have issues of teenage pregnancies because girls are engaging in transactional sex. And even some young girls get pregnant before receiving their first period. They engage in sex earlier. When they are starting their period, they conceive during their first ovulation.
So how have you been trying to maybe to stop this or to make sure that the situation becomes better from all this? What are you doing?
What you're doing basically is advocacy, because education is the only key to trigger the mindset and change people's perception towards period and a woman's sexual reproductive as a whole. I'm really happy that Kenya as a country is leading globally in issues of menstrual health. Now we have a policy, a menstrual hygiene policy, just a standalone policy on menstrual health. It's not talking about sanitation or anything, just about menstruation. And then through the policies, we have trained people at the national level, the train of trainees, and then county level, and then training stakeholders from the schools, the environment, different stakeholders like who are key in menstrual hygiene matters, including the county first ladies have been trained as champion so that they can spearhead the conversation about periods. So how we implement or we do our work, basically we have different technical working groups. We have sanitation and hygiene. We have health promotion, we have school wash. So through these technical working groups in different counties, we are able to discuss issues of menstrual health. And most we work with the schools because that's where the issue is.
Yeah. So tell us a little bit about the products that you're bringing up as an alternative to help girls curb some of the challenges, because yes, it's not easy to buy pads every month, maybe let me say at maybe 60 shillings. It's difficult for someone in the village. What are you doing as an advocate?
So for me, when I'm training about menstruation, I don't limit to products, but we do a holistic approach about it, talking about the stigma, just demystifying the stigma, as well talk about safe and hygienic use of products, and then we just discuss different products that are available. We have reusable, we have disposable, we have the menstrual cups, we have the menstrual patties. For the reusable parts, as long as it's sustainable, if those people can afford it, so that's sustainability. It's sustainable if the user accepts them. It's sustainable if the user can dispose them properly, so that's sustainability. And for the young girls who can't afford like to buy this disposable sanitary pads, every month we are getting donation from well-wishers. We advocate for reusable, which have a long lifespan. For us, as me as Kerry, I advocate for reusables with that microbial technology. We have SafePad, and we have the Kerry pad, which is my brand. The refugee adopted that brand. It's made by the refugee in Kakuma. So the unique thing about the SafePad with that microbial treatment, it has efficacy of killing pathogens. In case these young girls and women are coming from places with stigma where they can't dry the parts outside the sun. So as well, for those people who are coming from places where they can't get access to things like soap or enough water to wash the parts. So that's why we are advocating for the reusables with the antimicrobial, because of its healthy benefit. Because if you look at the disposable sanitary pads, yes, it can solve that immediate, it's affordable. But the disposable have expiry date, they have chemicals, and they have that polluting. If the girl is using the disposable pad for more than 4 hours, it's creating that environment for microorganisms, and they're going to get like infections, e.g. Urinary tract infection. So yeah, that's the reason as to why you're advocating for the reusable, because first they are safeguarding the health of the user. They are cost effective because the long term cost, if you calculate, you find like you're saving a lot of money, and also the environmental friendly. So Kerry pad is a reusable sanitary pad made by the refugees and used by the refugees in Kakuma refugee camp. So we came up with the Kerry pad because when I was distributing safe pad to the refugee camp, the refugee had an idea of having a livelihood project, and then they had that idea of having the sanitary pads as part of their one product in their sanitation kiosks. So, you go with the request of the user. So after requesting, we had a partner who are supporting that production. They're called Peace in Japan through the UNHCR. And they procured the fabric, and then during the pandemic, that's when Kerry pad was conceived. Because then it was really not easy maybe to get product from India or transport all those things. So the refugee thought it's easy for them to make their own thing that they can use. So that one creates accessibility, affordability, as well as the acceptability, because this is something they're making which is going to be used by them. Yeah.
Wow. So how has been the reception of this new product that you brought in under your name?
Yeah, the reception is good. So for me, it's just my name, but the product belongs to the refugees.
Okay,
So, yeah.
okay. Why did you give it your name? You came up with the idea, or?
I was a consultant and an advisor, and I proposed the names, and they accepted Kerry.
Wow.
Yeah.
Wow. How does it feel like?
Awesome.
Yeah. Wow, that's amazing. So how has this, or the whole of this experience been for you, being able to see even maybe a product being called after you because of what you've been doing?
For me, it's really great because you feel like you've created an impact. And then just like seeing people happy, that one makes you as well like, okay, I feel like, okay, well, I'm doing something even if you're not there. Because there's an issue of financial constraint. Like now there's a production ongoing in Kakuma, and there are a few challenges, but I'm really very happy about it. Yes, and then I'm happy about the local production because it's creating employment for the refugees. Yeah, as a source of income.
So now I want to hear your comment about the free sanitary pads program.
That's something maybe I'd not like to comment a lot about because it's such a lot of interest. The Minister of Education is giving, and then you find the women rep as well through the GAF thing. They're giving the sanitary pads. The first ladies as well, being the menstrual hygiene champion, they want to distribute the sanitary towels. So it's bringing a lot of conflict. At the end of the day, you find the beneficiary doesn't benefit because it's at a lot of political interest. Because if you're coming from a constituency that I don't like, and I'm a women rep or a politician, it means I'm not bringing them there. So I'm taking them to where I have acceptability. And as well, I can say from the school visit that we met, that program is a very good program from the government, but the actual implementation is not done properly. Because you can go to some schools, you find their sanitary towels in the stores and they have already expired. Like there was a case in Ruiru where the women rep had some free sanitary pads. They were stored somewhere and then they had expired and they were going to be sold. So those are the challenges of the government free sanitary pads.
Wow. So what would you suggest maybe as a solution to deal with some of these challenges you've mentioned, like having those different offices handling the same thing, and at the end of the day bringing conflict, and the girl in the village is suffering?
So for me, I think we need to have a system that can handle this properly, especially like now we have condom dispensers. If we have a pad dispenser, I know there's that innovation. I know some girls, they have their innovations called Dio pad. If the government can adopt the pad dispenser, na iwekwe mashule ama hospitali kila mahali, you see? So it means period poverty is going to end. And then also like they can sell condoms because sex is a choice, but you can't choose to have period or not. By then you can't like say like, let me postpone my period. But you can say like, okay, well, I feel like having sex, but now maybe I can like do next time. That's like something very possible.
Can you remember maybe the number of schools you've been able to visit, or the number of girls that you've trained?
There are so many. I think from the sanitary parts, like the dignity kits, you've managed to reach out to more than 500,000 girls. So that means it's a lot. I can't remember because it's more than 40 counties.
What's your key finding from your visit to girls and talking to girls? Like, do you have any findings, like the things that you discovered during your...
Yes, during that time you discover this girl, they don't have panties, they don't have safe environment. Like, during menstruation, girls need a safe space to change their parts. They need some water to wash their hands, and also they need someone they trust, or a safe space they can go when they have the period pain. So you find most of the schools and most of the places in our country don't have safe spaces for girls to discuss issues that are affecting them. Maybe you find someone is from a home where she just have a father, and it's not easy for her to discuss issues of menstruation with the father. If the school environment can have maybe a period clinic, it's easy for these girls to come there and then discuss what is affecting them. So what is lacking in our facilities and in the schools? We don't have maybe an emergency kits when the girls are having their periods, and then safe spaces. The latrines are really pathetic because especially the public schools, mnaelewa vile shule zilikuwa nyumbani. That's the situation. The way hiyo choo iko, msichana hata hawezi enda akachange pad. So those are the challenges. And other challenges is affordability of the pads. So girls can't afford to, like in that family, they can't afford to have 100 bob for a meal that day. So they are weighing like tukule chakula ama tununue maji ama ununue pads. So those are the challenges. And in some places, by the way, we go to some Samburu places or to go to the interiors, kuna watu hawajaiona the pads. So even the education about menstruation is lacking. Yeah.
Maybe in your training, you train both men and both boys and girls.
So what we do in menstruation is like in a holistic approach. You bring everybody on board, men and women. Even the TOTs, we have men TOTs to break the stigma. So basically just like as we grow up, we are all the same. When a kid is born, like a boy or girl, you can distinguish like is a boy or girl. Until puberty, my kifua kimeinua nguo, we start having periods, and then the boys start having the wet dreams. So then it means maybe if a girl engages in an unprotected sex, she's going to get pregnant. And then maybe some of the boys as well, they think they're kids. Wanafanya wengine washike mimba, and then they think they can't be fathers.
Yeah.
So that's how you find girls getting pregnant before receiving their first period.
So you do all this training like holistically.
Yeah.
It's not specific to maybe taking girls and showing them how to use pads and blah blah.
No.
Okay.
So that's like a process, and then that's the time you just say like when girls are using pads and the panties, the boys are using the boxers. Yeah.
And how are boys maybe taking this kind of training?
When it's inclusive, yeah, they are part of it. In fact, they really do contribute a lot. Unlike when you have girls aside and the boys aside. So like vile nilikuambia, ukienda shule kwa na pads unapea boys. Unapea wasichana. Next time the boys are seeing you coming and then they walk out, they see like ni mambo ya wasichana. But when they're part of the conversation, even you try to encourage them to chukua hizi parts muwapatie, because like you have a girlfriend, you have maybe a wife, you're going to have a daughter. That's why we need men to be part of the conversation. When they're doing shopping, they remember like sanitary pads have to be part of the shopping. Yeah.
And maybe let me. So these are the reusable pads.
Yeah. You can open.
Okay.
Let me open for you. And then, during when you're training, now you've talked about everything. There's that element of having first period.
Okay.
Before even you receive the pads.
Oh.
So girls have to understand what happens.
So you want to take me through that process before nishike pad.
So before
okay.
that one,
before
she starts thinking about the pads, she has to have the right information, what to expect when the first period are coming, what are the signs, how one should behave. And then you bring the element of the sanitary pads, because mostly we have the disposable. That's what they can get. We have the menstrual cups.
Okay.
And then we have even this, it's an hygiene towel. It has the antimicrobial. So if these girls don't have access to clean water, they can use the water available maybe in the school environment. They dip the towel in water and then they just panguza the menstrual cup, they clean their hands and save to...
So maybe you'll explain to me what the work of this menstrual cup. And I know most men might not know.
The work of the menstrual cup is the same work of the disposable sanitary pad, which is this one. This is a dream girl. So the dream girl looks like this. I'm not having my panties, but if I could be having my panties. So basically unaweza eka. I'm not ashamed, and then unafunga. So you see the way this one has the wings, the other one. This one has no wing. So ili tukifanya uko nani. But it is okay. So for this one, you saw the other one, the disposable has wings. But this one has buttons. So for example, this is my panty, and then unaweka, unafunga. So msichana akivaa anafaa tu still kama yongine, and then she's comfortable. It has the leak proof, and then it has the absorbent, and the most important we spoke about is the antimicrobial, which has the efficacy of killing pathogens.
So now maybe wakishatumia, so hii wakishatumia
they wrap it if they are in school. After kufunga wanaenda nyumbani, they wash it, they dry it properly, and then keep it or use it.
Wow. Na hii,
so the super towel is an hygiene item. This is an option to hand washing with soap. So especially during emergencies, we find people don't have access to clean water and soap. But if they can have the super towel, which has the antimicrobial technology, they can use it to cleanse their hands. I know you go to the restaurant, you are given a towel with mint or something. So
inakuanga na hiyo. So na hii sasa,
the menstrual cup is the most sustainable, I think, a long-term product for one to use during periods. So if one amenunua moja, unaweza tumia for 10 years. The reusable can be used for 4 years. The disposable inaweza tumika maybe for 3 hours, but this one can last 10 years or more. So this one, msichana anafunga vizuri. I know you know some, you've heard, or if you don't know, you've heard about tampons. So the menstrual cup is like a tampon. So anatumia, she can use even for 8 hours. And then after kumaliza anaenda na mwaga damu, anapanguza, anaosha, anatumia tena.
Okay. Now, the next one was, you told me you have a game. There's a menstrual game. I want to, is it a period game? I want to play.
So
I don't know.
This is a menstrual plate. So this, like when you're talking to girls, then they have to recite, they have to pledge like I'll break stigma, I'll break all the silence surrounding menstruation, like a wimbo. It's a national anthem for us.
Okay, so inachezwa aje?
This one is ya kuchezwa. Kama you move around a wimbo, we have a circle. Our circle is for 28 days. So if this one
okay.
Unaanza moja, unazunguka, unajua when your fertility days are, and then you know your ready days are coming, and then you see like, so this is like something to help girls to learn about their cycle. And then we are there next.
So like now it indicates all the information for the whole month.
For the whole cycle, for the whole month.
Okay.
So unaenda number 1, number 2, number 3, mona. So first ukianza number 1 is our female reproductive organ. So this is us, and then you move around. Talk about the uterus, is connected to the ovaries and the fallopian tubes, and then girls receive their first period when an egg in one of the ovaries matures. So and then you move around. So this is just a basic training. Training manual. So about the period game, the period game has different period products. So nastahili tuweke chini tutawekelea wapi?
It's still okay. Don't worry.
So this is how it is. So ni kama kucheza cards. So unaweza chukua zako.
Whoa. This is interesting.
Anyway, let's play the cards are easier. Hii unaweka kuna hizo. So unajua hizi ukiweka ikianguka, so utajua. So it has different products.
Ati ikianguka
tunacheza tu ukiweka kama ukisema kama ni tampons or something that ukiweka tu hivyo. I'll just show you but in a long process more.
Okay.
Ni kucheza kadi kama zile za kupeana madogo za just like a means of demystifying period stigma and trying to trigger the behavior change of people towards menstruations. Yeah, this is one of the tools we use. Kama I want to engage men in this conversation, maybe we start by playing our card, minus a panty.
So yangu haina nini? Haina kitu. Hiyo ni ya nini?
So hiyo unaweka kando and then which product you have?
Tampon.
Yeah, unaweka sasa hapo ukiweka tampon.
Tampon,
Then me as well have a tampon.
Hii ni +1. +1 ni nini?
Eka tu kando.
Okay. Mbona umeficha hivyo? Mimi nimepata pad na wewe.
Alafu na mimi nimepata tampon. So maybe this one after the game we say bye. Yeah, so the game is basically to demystify and then having people in the conversation.
So una involve both boys and girls in these conversations?
Yeah, the boys and girls have to play the period games, like playing the cards.
Wow.
Yeah.
So how is it like, wakati wakianza kucheza hizi games like both boys and girls wanafeel aje?
You know, they like games. Even we have football for periods, so there are people are playing like we have the 17 SDGs and that ball as the SDGs. We just pick like we're talking about good health. So someone has to talk about good health in relation to periods.
So Roisa, I want to hear from you, like from this, what is your goal from all this, what you're doing? Or from your campaign and your activism around?
My goal is to end period poverty.
Yeah.
Yeah.
Is it possible?
Yeah, it's very possible. Yeah.
How?
By having everybody in the conversation and having government listening to the needs of girls, because we can't afford to leave like girls behind and then boys are developing and we expect like we achieve like a stable economy or maybe the sustainable development goals, because ukiangalia ni watu wengi duniani ni wanawake. So how can you leave them behind? So having everybody in the conversation, as we said, like menstruation, women empowerment is key for us to achieve the SDGs from good health, health education, gender equality, water sanitation and hygiene, and all those things. Yeah.
And maybe as we finalize this conversation, what are the challenges? What challenges do you face in your campaigns around menstrual hygiene and everything that you do?
So the biggest challenge is stigma, the acceptability, the way communities perceive period, especially when you're starting like in the nomadic communities, including Kisi where I'm coming from. Not people talk about it, so you find there is lack of education on menstrual health. So if we can just at least build this gap of lacking proper information about period, because all along people knows period poverty is lacking sanitary pads. They forget that period poverty is beyond these
sanitary pads,
menstrual products. So period poverty involved from the psychosocial. There's pain. You find most girls, they have endometriosis or fibroid, but they think it's just a painful period. So they end up having long-term impact. Some of them may be infertility issues because this reproductive health issue wasn't addressed from an earlier age. So lacking of education and awareness about our reproductive health is hindering us from giving the right information about girls and women's issues. And another challenge is finances. You find most developmental partners, including the government, they have a limited budget for menstrual health. Yeah.
Wow. All right. So that's amazing. Anything else that you would like to share with us that maybe I haven't asked you? This is an opportunity for you.
So maybe what I like to advocate is like, let's have inclusivities, let's have facilities that are friendly to people with disabilities, because we find like girls with disability, they can't use most of the products that we have for the abled.
Like
So the people are able,
yes,
who are not able differently. Like a girl with autism can't use this part, so we need to think and invent other mechanism and other means of advocating and having a solution to challenges women with disabilities are facing.
yeah.
And also I'd call out for the government and other partners to prioritize menstruation and have a budgetary allocation for menstrual health. And men like you from the media need to advocate and air this issue. You know, there's that element. If you just follow Janet Imbua, she has a lot of like followers on that. Like, but if you have men who are advocating for women's health, sexual reproductive health, menstrual health, kuna vile watu
wanaanza
yes, most people see like now this is something that we should be talking about. Like, I'm very happy about Kenya now. Everybody's out about talking about sanitary pads.
Yeah. Thank you very much for tuning in and watching today's episode of Before 18. We are discussing menstrual health hygiene, which is a very important subject that I encourage every man to get into, because you know, we belong to women and women belong to us, and we are all one community, and we have to take care of each other by making sure that, you know, we end stigma in our society. That was Roisa Kerry, who has shared her story on how she's campaigning for the rights of girls and just to reduce the levels of shame on girls in our community. My name is Colin Sorono. See you again next week, same place, same time. Bye bye.